I'll start my little intro over then, so it can be captured for posterity. So I am Cynthia LaChase Torres, and I have been serving as the acting director of race and equity programs here for the county since July. Prior to that, I've been with Arlington County government for more than 23 years. I've been working in the Department of Community Planning, Housing and Development, specifically working in history and historic preservation. So I'm excited to be part of this team and helping out with the race grants this year and working with our United Way partners and with members of the community over these next few months. So the focus of today's technical assistance session will be on some modules that Arlington County government developed entitled Leading with Race. And this is an online learning series, and these videos were developed by Arlington County in collaboration with several staff members. So together today, we are going to review 3 of the 8 modules. And as you are watching, we would encourage you to start considering how you might use the information that you've learned to describe your organization's programmatic needs and just thinking through how this might provide some insight for you as you're working on your grant proposals. So collectively, these modules can be used not only by county staff, but by residents and organizations to learn basic terminology and concepts around racial equity work. You will also gain awareness and knowledge that will help reduce and eliminate race-based opportunity gaps while improving outcomes for everyone. It should be noted that any reference to external sources and/or organizations in the modules does not imply those individuals' endorsement. So a quick caveat, the views, thoughts, and opinions that are expressed by county employees in the videos are solely those of the employees in their personal capacity and don't necessarily reflect the views of Arlington County government as an organization or any of its officials. And then I'll just add, if your personal time permits, and this is something that's of interest to you and you really want to watch all 8, we'll go ahead and put the link for them in the chat. So if on your personal time you wanted to watch the other ones or share the ones that we're watching today with others and have your own conversations, we'd encourage you to do that. So at some point we'll get that link in the chat for you for your future reference. And so any immediate questions before we get started and watch the first video together? All right, so allow me a moment here to try to get technology to work and share my screen. I'm sharing sound. And that's not working. Hold on. All right. Do you all see my screen? I see Steph, you're nodding your head. All right, so I'm going to press play and we are going to hope for the best that everyone can hear it and everything functions as expected. So here we go. So this first module we're going to be watching is the 3rd one in the series. It is entitled, What is Racism? And in this video, we will explore the definition of racism, plus the 3 different levels of racism that comprise the system. So with that, start. Everything working? Okay.
Hello, my name is Joe Kang. I'm the Enterprise Change Manager for Arlington County. Thank you all for continuing this journey with us to advance racial equity. In the last module, you learned a little bit about race, a snapshot into the history of race, what it means, and the differences between race, ethnicity, and nationality. Today, we will break down the definition of racism, along with identifying the different levels of racism. We need this understanding before moving to the impacts of racism, which will be covered in the next module. As conversations about race and racism are happening more frequently, more people are beginning to understand that structural and systemic racism is a serious problem. These two terms are used interchangeably, but for our purposes, we're going to stick with systemic racism. Systemic racism has directly harmed Black, Indigenous, and people of color, which we will refer to in our training as BIPOC or BIPOC communities. Learning about systemic racism is the first of several important steps toward healing and creating an equitable society that benefits us all. All credits for this module are linked on the Leading with Race website, but you can also view them as you go by clicking on the information icon. For those that want to dig deeper into a concept, you will find book icons throughout the module that you can click on for more information. So what is racism? There are many definitions that exist on racism, but this is the definition that we will use to ground our learning through these modules. Racism is a system of oppression based on race in which one group has the power to discriminate against other groups through major institutions of society. This definition is pretty complex, so we will break it down. Click on each highlighted word to learn more. You must go through each word to continue. A system is an established way of doing something that becomes routine and normal, and is rarely questioned or challenged. A system can operate itself and require no planning or action for it to continue. One system we are all familiar with is the digestive system. This system is made up of 9 organs and is one of the most complicated systems in the human body. The various parts work together to transform your food into nutrients and energy. The system is there, whether you are aware of it or not, and is constantly working. While the digestive system is a passive process, the system of racism has been woven through the fabric of our society either intentionally or unintentionally. This complex system is a part of every aspect of life, even if we do not see it or feel it. Oppression is a system of power in which one social group, not necessarily the majority, exploits others for its own benefit. Each of us holds several social identities in our lives. Within each identity, there are dominant and non-dominant groups which can create space for oppression to occur. This can result in a lack of access, opportunity, safety, security, and resources for others. One example is our right to vote. Previously, voting was limited to landowning white men, leaving out white women, people of color, and other marginalized groups. By excluding a big portion of the population from decisions, we ignore the unique perspectives of each group. A current example of how groups of people are excluded from the voting process can be seen in the challenges faced by people in BIPOC communities who are, or have been, incarcerated at disproportionate rates. Discrimination is the unjust and unfavorable treatment of people or groups of people based upon characteristics such as race, nationality, gender, sexual orientation, disability, age, or religion. Major institutions or structures of society play a role in creating and supporting humanity and are shaped by policies and practices that have historically impacted people in BIPOC communities. A few examples of major institutions are educational, political, economic, family, and religion. Let's put it all together. Racism is a system of oppression based on race in which one group has the power to discriminate against other groups through major institutions of society. A quick way to think about it is that racism equals power plus prejudice. Now that you have a better understanding of how we define racism, we will look at 3 different levels of racism. The levels of racism have been defined by the Government Alliance on Race and Equity, otherwise known as GARE. The county's racial equity work uses GARE models, frameworks, definitions as a foundation. These levels are individual, institutional, and systemic. When we recognize that racism operates at different levels, we can move beyond our individual anxieties to focus on institutional and systemic change. Having a shared vocabulary allows us to talk about racism with specificity, so we can work together to promote racial equity. Click on each button to learn about each level of racism. You have to click on all 3 to proceed. Individual racism can be described as the room we are all sitting in, our immediate context. It is the prejudgment, bias, or discrimination by an individual based on race. It is the conscious and unconscious beliefs that whiteness is superior to marginalized groups. We all carry biases in our daily lives. Bias is a prejudice towards a person, a group, or thing relative to another group. Some are positive and helpful, but often they are solely based on stereotypes. This can result in prejudgments that lead to rash decisions or discriminatory practices. Bias can happen with our knowledge, known as explicit bias, or without us realizing it, which is called implicit or unconscious bias. Biases are influenced by media, our upbringing, and past experiences. Acting on our biases can be discriminatory and can create negative outcomes for particular groups, so it is important to pay attention to these potential biases that we all hold. Institutional racism is the building this room is in. It is the institutions and systems of power that exist. This refers to unfair policies and discriminatory practices of particular institutions such as schools and workplaces that are adopted and maintained, producing racially inequitable outcomes for people of color. Systemic racism is the skyline of buildings around us, all of which interact to dictate our outcomes. It is a combination of historical, social, political, institutional factors that create a system that negatively impacts communities of color while creating different treatment, access, power, and advantage for white people. Let's take a look at how these levels work together to create the system of racism. While there are many ways that racism exists, we're going to focus on two areas that demonstrate the different levels: education and healthcare. While these scenarios are fictional, they show one of many potential outcomes. Data is shared throughout to support why and how these situations can happen. Click on each image to view the scenario.
When looking at the education system, disparities by race and gender can be seen in all categories of disciplinary action. This is evident as we look at Black girls in the school system. Let's take a look at the impact this has had on Ashley. Ashley is a 16-year-old junior in high school. Her father passed away when she was younger, and her mom is working 3 jobs to support the family of 4. She aspires to get a scholarship so that she can go to college to study engineering. Ashley also has a part-time job where she frequently does not get home until after midnight. Ashley's math teacher is frustrated that she is frequently absent or falling asleep in class and assumes school is not a priority for her.
Explore some options that could be done by the teacher at this point. Click each icon. Without talking to the family, he can't really be sure what is happening in Ashley's life. Information and understanding can stop assumptions or biases. Ashley's teacher has a personal bias based on previous experiences with Black students and their families, and is making assumptions based on that information. There is a link between teacher beliefs and student achievement, so his negative beliefs can have an impact on Ashley's academic success long term. Teacher perceptions matter for student expectations and achievement, especially for BIPOC students. By checking his bias, he can see where his feelings are coming from.
Ashley's family needs support, but they do not know where to go or what is potentially available. Her school is overcrowded, and most of the students are Black, Indigenous, and people of color. Ashley is starting to believe that she isn't cut out for college. That, along with her stress about the financial situation, causes her grades to decrease.
Explore some of the challenges Ashley is faced with. Accessing support is difficult for Ashley's family. Nationally, data shows that BIPOC students, specifically females, are more likely to fall through the cracks in the education system. Under-resourced school systems that concentrate people of color in overcrowded schools result in higher dropout rates and disciplinary rates compared with those of white students.
School administrators have an attendance hearing with Ashley's mom. After the call, Ashley had to cut back on her hours at work and is unable to help with the household finance. Ashley returns to school the next day only to realize there is a midterm she did not study for. Ashley's friend pulls the fire alarm so that she and Ashley have time to study. School administrators review the security cameras and see Ashley and her friend at the alarm. Ashley gets caught. charged with calling emergency services without cause, which is a Class 1 misdemeanor and referred to juvenile services. Her friend did not get charged. As you can see, there are many contributing factors that led to her interaction with the justice system as a Black girl. She's stuck in a web that she's struggling to get out of.
Learn more about why this matters in our system. Black girls are 6 times more likely to be suspended or expelled than white girls. High suspension and expulsion rates can contribute to potential incarceration later in life. This is known as the school-to-prison pipeline.
There is no question that COVID-19 has had an impact on all of our daily lives. However, this pandemic has shown that health equity continues to be a challenge as this virus has impacted BIPOC communities the most. These communities are more at risk of getting sick and dying from COVID-19. Let's see how Carl was personally impacted. Carl enjoys his job at the grocery store because it allows him to meet new people. As an immigrant from Colombia, English is his second language, and he speaks with a heavy accent. He has found this to impact some of his interactions with others. In previous doctor visits, Carl felt his doctor had not taken the time to understand what he was trying to be treated for due to the language barrier and cultural differences.
Explore potential concerns you see with Carl's care from his perspective. Click each icon. Language barriers can be difficult, especially when there is negative bias associated with it. Cultural differences between patients and physicians, coupled with language barriers, can impact the interactions and healthcare quality. It can also result in a lack of trust with medical care.
Carl is considered an essential worker, so must go in person to work. Due to COVID-19, new safety protocols like mask wearing, distancing requirements, and cleaning procedures were implemented to slow the spread of the virus. Despite the new protocols, he starts showing symptoms of COVID-19. His employer wants him to quarantine for 14 days unless he has proof of a negative COVID test.
Explore some potential workplace impacts of COVID-19 for the Hispanic or Latinx community. Hispanic or Latinx demographic in the U.S. largely works in service jobs. These industries required employees to be on the front lines and risk infection during the COVID-19 pandemic. Examples are workplaces like hospitals and grocery stores. Nearly half, or 49%, of the Latinx population say they or someone in their household had to take a pay cut or lost their job, or both, due to COVID-19, compared to 33% of all U.S. adults. Many also lost jobs due to working in industries like hotel and travel that crashed.
As an essential employee who relies on public transportation and lives in a high-density apartment complex, it is difficult to identify how Carl was exposed to COVID-19. Since he does not have health insurance, he held out on going to the hospital as long as he could. There are many factors Carl experienced that could contribute to the lasting financial impact sustained when hospitalized without insurance.
Learn more about why this matters in our system. A higher percentage of people in BIPOC communities work in essential settings, putting them more at risk for exposure. For example, with Arlington County residents, the number of positive COVID-19 cases in 2020 for Hispanic or Latinx people were almost 3 times that of white people. While language barriers are faced practically everywhere, they can have negative consequences in communication, healthcare delivery, and patient safety. These scenarios are very different but show a similar story. Today, in the United States, systemic racism drives outcome gaps between people of color and white people across every indicator for success. Thinking back to what we just learned in the education scenario, if schools are under-resourced, this can impact the quality of education and resources people have access to. Limited education determines opportunities for employment, which in turn dictates where you can live and which resources you have access to, such as healthcare, fresh food, and open space. Together, all of these areas create systems that adversely impact the quality of life for Black, Indigenous, and people of color. By leading with race, we aim to transform our institutions and systems so that we can eliminate these gaps while improving outcomes for everyone. One step to transforming our institutions is understanding the data that exists. The Race and Ethnicity Dashboard and the associated briefing paper are great tools to explore the direct impacts in Arlington County. The Uneven Opportunities Landscape Report by the Northern Virginia Health Foundation also provides additional context on inequities in Arlington and other parts of Northern Virginia. You can open these resources now or find them on our website.
So for the ones that are interactive, I'll take some audience shout outs for what's correct versus incorrect. So what do we think the correct answers are in this case? Don't all speak at once.
Feel free to drop it in the chat too. If you don't want to unmute, you can drop your responses in the chat.
Thanks, Stephanie.
I would say all intersectionally.
I hear what you're saying, but we have to pick two for the sake of this exercise in order to move on. That's a bigger conversation. You're right.
Duly noted.
Anyone want to take a guess based on what we've watched?
Well, based on what we watched, health and education.
True, but of these tabs here, individual, institutional, or systemic?
Individual.
Okay, let's see if we're right. Oh, I have to click both. All right, so that we'll click on that one. What's another one people want to pick?
Institutional.
Yeah, I'd say if it's the county, Arlington County, and looking at institutional and maybe systemic.
Okay, so I'm not sure why it's not letting me do anything. Let's see. Okay, so I guess we got that right.
Today,
All
we
right.
covered the definition of racism and reviewed the 3 levels of racism. You followed 2 scenarios that showed what the levels of racism can look like in action and why focusing on institutional and systemic levels can have the biggest impact on outcomes for everyone. Thank you for joining us as we continue our journey towards racial equity. We will see you again next time as we examine the impacts driven by the system of racism. You have completed the first 3 modules. Click each marker to...
I was just going to say, it looks like it was systemic and institutional for the answer to that question, just based on the summary, right? Just to make sure we got that.
Yes, you're correct.
Thank you.
Okay, so I think for the sake of time, I'm not going to continue through to the credits and the feedback form. So let me stop sharing for a second. Okay, and so that was one of the 3 that we were going to watch together this afternoon. And before we move on to the next one, and I'm also going to close my Outlook because it keeps popping up. I have a couple questions that I thought we could just discuss as a group about each video and as a nice little break in between everything. So after watching this first module on what is racism, just curious about folks, what are your initial thoughts or observations? And feel free to use the chat too if you don't want to speak aloud to the group. And there's no right or wrong answer. This is just food for thought conversation. Did people find it well organized and a helpful way to explain a difficult concept?
I thought this is John. I thought the definitions on the front end were good. I've seen a couple other versions of this with other institutions, and I thought the definitions were clear. I think as it moved into the examples, there was a little bit lost in terms of that connection between the definition in terms of the application. But that's life. That's how it happens.
Yeah, no, that's a fair point. Thank you for sharing that, John. I think someone had put something in the chat. Monique. Monique says it's great to see these as a resource to the community. We agree. It's been really helpful for the county workforce, and I'm glad that we're able to have them on the website so they can be shared beyond us. Any other thoughts or observations anyone wants to share?
I just have a question. If all the modules, the 8 modules, have all county staff been through this in a self-directed way or partial? To what extent has this been rolled out in the county?
No, that's a great question, Christine. Thank you for asking that. Yes, this is something that has been required training for all county employees in the workforce. This was they first came about under the direction of Samia Bird, who was the county's first chief and race official. And so there are going to be a total of 10 of these videos, and we have 8 of them completed thus far. The other 2 are still a work in progress, but these are things that are part of our interdepartmental workforce training for all county employees, no matter what department that you work in. That was a good question. Thank you.
And all the evaluators of these proposals also watch all 10 or 8. Is that correct?
They will be watching these same ones that we are watching here together, with the option to watch all 8 of them if they would like to. Did I state that correctly, Elizabeth?
Yes, that's correct.
Okay. Okay.
Very good. Thank you.
And so my last question on this one, and John, you highlighted this a little bit when you shared your comment with us, but just curious, were folks in agreement with how racism was either defined or explained in this module? We've heard from one of you that the answer was mostly yes.
Yes.
Great. Any other thoughts before we move on to the next one? Everyone take a quick stretch, refill your water, your tea, your coffee, whatever you have to get through the afternoon. Give me a second on the back end here to pull up the next one. Bear with me. And of course, my whole screen closed when I closed out of it before. All right, so the next module we are going to be watching together is module 4 in the series, and it's entitled, What are the Impacts of Systemic Racism? We will look at data as it relates to 6 major institutions, including housing, education, employment, the justice system, health, and transportation. This module will help us better understand how creating goals and objectives around racial equity can benefit everyone. So let's see if technology is on our side again. Someone give me a thumbs up or a yes, you see my screen?
Yes, we see your screen.
Perfect, here we go.
Today, we went through major institutions that have historically impacted people in BIPOC communities. We reviewed data that exists in each of the areas.
Okay, hold on.
And we discussed how creating goals and objectives.
I'm not sure why it started at the end, so let's try that again.
Hello, my name is Joe Kang, and I'm the Enterprise Change Manager for Arlington County. Thank you for continuing this journey with us to advance racial equity. In the last module, you learned about the different levels of racism. And by following Ashley or Carl, we're able to see how these levels can work together to create the system of racism. Today, we will see how racism has a cost for everyone, not just for people of color. This module is dedicated to reviewing the impacts of racism, and due to the nature of the topic, there's a great deal of data. The content and data shared highlights significant disparities that exist between different racial and ethnic groups. We recommend that you set aside at least 15 minutes to review and complete this module, or more if you wish to go through each of the sources linked. For those that would like to review the content in Spanish, You can click on the Notes section to review the translation for each slide. If you would like to view the full script in English or Spanish, click the appropriate button to open. Race, income, and wealth are closely connected in the United States. However, racial inequities are not just about income. When we hold income constant, there are still large inequities based on race across multiple indicators for success. Often, these gaps are explained away by blaming individual people, promoting quote-unquote hard work as the way to get ahead. However, underlying systems are a force driving inequities. While people of any race can be impacted in these areas, each of these major institutions have outcome gaps or inequities that exist for Black, Indigenous, and people of color, or BIPOC communities. If you only address one area, you likely can make an impact on that area, but will not produce the desired outcome overall. You have to think of these major institutions as part of a system that impacts one another.
Okay, so in this next segment, you see the 6 circles here with different subject areas. The last time I was in this training, the gray circles are the ones that I looked at, but I would like to welcome feedback from the group as to which of the circles you would like to listen to as part of this session. Any preferences?
I'd be curious to hear the housing one.
Okay, we'll start with that and then I'll pose the question again.
Everyone should have access to healthy living environments that they can afford within a desired distance to resources needed to live. Angela Glover Blackwell, founder of PolicyLink, has observed that the connection between housing and access to opportunity is impossible to ignore. Address is a proxy for opportunity. Where we live determines whether or not we have access to the requisite resources for success, including good schools, decently paid jobs, and transportation that connects to employment centers. It determines whether or not we have access to healthy living conditions, whether the air is reasonably clean or fouled by pollutants, whether we are likely to develop a long list of chronic illnesses, and if we do, whether we will survive them, whether we are likely to be killed during a crime, in a car crash, or simply when crossing the street. Any serious discussion of poverty inevitably turns to prevention and well-being, and that brings the conversation straight into the places where people live. In Module 1, we introduced the concept of redlining, where the federal government, private banks, and other lending institutions denied credit and loans to otherwise worthy credit borrowers in certain neighborhoods based on race and/or ethnicity. Economists are now able to see that there has been a lasting impact when comparing old redline maps to current realities. Disparities can be seen in home ownership rates, home values, credit scores, and racial segregation in these areas that were previously considered quote-unquote hazardous or redlined. The creation of these maps continue to contribute to the future outcomes of the people living in them. Click through each area to learn more about the data related to housing. The lack of home ownership among communities of color diminishes wealth and the ability to purchase a home.
I'm going to go through these pretty quickly, so then knowing that you will have the link to these, so then you can study them in more detail on your own.
By better understanding mortgage and denial rates, we can uncover more detail about loans so we can make home ownership more affordable. Residential segregation sorts people into particular neighborhoods on the basis of race. Neighborhoods connect, or fail to connect, residents to jobs, goods, and services. Based off what you learned, what are some of the impacts of racism seen in housing? Click the correct statements.
Anyone want to entertain a guess?
Higher loan debt.
Great. Another?
Someone
I
put
think it's
all in the
unfair.
chat too.
If someone else could watch the chat, that would be helpful. I've got too many tabs open.
Yes, yeah. Someone placed
said
all in the chat. Yeah, someone put all 6 in the chat.
Shall we keep clicking and see if we're right? Nope.
Limited access to healthy food.
Yeah,
Correct.
for sure.
Correct. And I'm pretty certain these are
Both
incorrect.
no's. Yeah.
Yes. Yes. So again, I apologize. We are going through these kind of at a clip, but I want to make sure that we can answer questions in between and get through the 3 we want to watch. All right, so we took a look at housing. Is there another category that is of interest to those on the call?
Health would be interesting.
All right, we'll do that one next.
Bias, prejudice, and stereotyping by healthcare providers contribute to lower quality care for people in BIPOC communities. Access to nutritious food, preventative health care, and health insurance are all predictable by race. Neighborhoods with lower life expectancy tend to have other poor health outcomes. While length of life doesn't imply quality of life, people of color are far more likely to die early from preventable illnesses because of systemic impacts across the major institutions. These early preventable deaths could also mean instability for families and communities. Click through each area to learn more about the data related to health. Having health insurance makes a key difference in whether, when, and where people get medical care and how healthy they are. Uninsured people are more likely to postpone or forego health care. Being uninsured can also have financial consequences, with many unable to pay their medical bills. The systemic racial inequities that exist across the major institutions correspond with large gaps in life expectancy. Racial and ethnic health inequities have led to higher rates of illness across a wide range of health conditions. Click each icon to see data for each highlighted area. Food security is having access to healthy food when you need it. Food insecurity impacts about 10% of U.S. households. Drag the risk factor to the right of the correct statement.
So for this first one here, can impact someone seeking health care. Which of these 4 do you think that
Health insurance.
correlates best?
Health insurance.
Yes. And what about death rates have dropped but impact non-Hispanic Black people the most?
I'll say heart disease.
Okay. Can improve health conditions like diabetes and hypertension.
Healthy food.
Healthy food.
Yep. And then lastly, impacts 1 in 5 adults. Let's see how we did. Great. All right, so we've gone through housing and health. Why don't we try to do at least one more? What is the consensus of the group?
Could we do employment?
Sure.
Thanks.
All workers should earn a living wage that allows them to meet their family's basic needs. Since employment is the main source of income, unemployment is strongly associated with poverty and contributes to the wage gap present in the U.S. Click through each area to learn more about the data related to employment. People are classified as unemployed if they do not have a job, have actively looked for work in the prior 4 weeks, and are currently available for work. Higher wages improve living standards, provide greater workforce stability, and contribute to retirement funds. Belonging at work means you feel seen for your unique contributions, connected to your coworkers, supported in your daily work and career development, and proud of your organization's values and purpose. Here are 2 examples of how belonging can play out in the workplace. The most highly educated Black workers are still less likely to be employed than their white counterparts, and when they are employed, are less likely to be employed in a job that is consistent with their level of education. Drag the correct response under each question.
All right, so another group exercise for us. So for question 1, if you do not have a job, have actively looked for work in the prior 4 weeks, and are currently available for work, which term applies to that scenario?
Unemployment.
Unemployment.
Yeah.
Yeah. All right, next we have a set of environmental conditions that can determine if employees do or do not feel out of place at work.
Belonging.
Belonging.
And then lastly, what financial asset contributes to wealth? And let's go with retirement. All right, well done. Would folks like to do another one? Or move on? It's up to you.
We can move on.
I agree.
Okay.
Each of us experience barriers to achieving the success that we want in life. Working harder or making better choices are not always the answer, especially when you have systems that are impacting you throughout the process. The data shared today is just a snapshot of the data that exists, and that was shared to help you make connections between the impacts seen in each of the major institutions. The goal is not to just eliminate the gap between white people and people of color, but to increase the success for all groups. If we develop goals and outcomes around racial equity, we will see improvements that will benefit everyone. One example of this can be seen when we look at high school graduation rates. While students of color have disproportionately lower graduation rates, there are also white students that do not graduate. Strategies created to support students of color also benefit white students. Another example can be seen in the inequities in our justice system. These inequities are devastating for BIPOC communities, especially Black men, but are a financial burden for all of us. Reducing incarceration rates and reinvesting funds can benefit us collectively. As mentioned by the Government Alliance on Racial Equity, systems that are failing communities of color are actually failing all of us. Today, we went through major institutions that have historically impacted people in BIPOC communities. We reviewed data that exists in each of the areas, and we discussed how creating goals and objectives around racial equity can benefit everyone. As a reminder, make sure to check out the Leading with Race website and discussion guide as you continue understanding the impacts of systemic racism.
Okay, I'm going to stop sharing here because the rest, again, is the highlight and the credits. for those of you who are really interested in the data aspect of things, I think this is a particular module that I would direct you back to spend a little bit more of your own personal time on there. And there are links to resources both within the module itself as well as on our race program webpage if there, you want to do a deeper dive into any of the resources and sources that were cited. So in terms of questions, I was just curious, was there a particular data set or one of the institutional categories that resonated most with you, either based on your experience or based on your line of work?
Earlier today, I went and was looking at the race dashboard, and I left with the impression that it was somewhat static, and I didn't see a lot about health in there. I was just wondering if I was just looking at it wrong or was not accessing it correctly.
For the data dashboard, that's something
Yeah.
we're gonna take a closer look as part of our last module
Okay.
in a few minutes. And it's my understanding that they're not static, that it is evolving information, but I might need to verify that. Elizabeth, I don't know if you know the answer to that.
Let me clarify the word static. The static in the
Okay.
sense of is that the data that are coming out are somewhat scripted, and what you have is the ability to change what race you're looking at or what ethnicity group you're looking at. But I didn't see much more in terms of being able, say, for example, to explore diabetes as a topic.
Understood. No, that's definitely good feedback as we look to how to make the dashboard more useful, but we're going to get into some more specifics on the dashboard in the next couple minutes.
Okay, great.
I just had a question because I haven't looked at that dashboard yet, and I know we're going to get into it.
Yeah, sure, Judy.
Is this tied to Arlington County specifically? Can we see that data specific to Arlington County and by segments of the county?
Yes.
Okay, thanks. Like I said, I need to start looking at it. Thanks.
Of course. So my other question with this module, and again, there's no right or wrong answer. This is just food for thought to get us thinking about what we've been watching and learning about together. In your opinion, which institutions of systemic racism have most impacted members of Arlington's community? Was it things related to housing, things related to education or health, justice, like what were the other ones that we didn't watch? There were 6 altogether, but we watched transportation. So I think that's most of them. So any of those folks feel have had such a large impact on our local community?
We just did a survey for a backpack event. We had 700 people attend. We took survey, probably results about 250 people.
Okay.
Housing was number one. Food was number 2. Transportation was number 3. And then after school care was number 4. So it's all playing to some of the issues we're seeing in South Arlington. That's why I'm asking about the data.
No, thanks for sharing that, Judy. Other thoughts?
I would say real quick, I'm Robert Elfton, and I work for ECDC, the Refugee Resettlement Agency.
Hi, Robert.
And hey, how are you? As I was watching this, the module on racism, I was trying to think like what experiences I've had going out with refugees. I was a housing director, so I was the guy taking refugees into leasing offices. And you know, it's so many of these things are hard to disentangle. Like race, you know, when are you experiencing racism versus xenophobia versus just leasing offices just looking at the financial numbers and just deciding that the risk of bringing in a refugee who's only been in the country for 7 days, you know, are they going to pay their rent 6 months down the line? So, I mean, I know I'm stating the obvious here, but like so many of these things these issues are hard to look at in isolation because they're so complex. And I mean, even from a refugee perspective, like they could be experiencing racism, but I don't even know if they even recognize it because some people have been here such a short time that they don't know what the norm is. So if they're being treated something outside the norm, they may not know it, and that's why we need, you know, like people like those on this call and this grant foundation to kind of help us to get to the nub of these issues, because you know this whole that whole module kind of presented the issue as one that if we can all work on it, we'll all benefit. But I think part of the problem in society is that too many people view it as a zero-sum game. Somebody's advancement is someone else's loss by definition. And when you go down that road,
Yeah.
it's problems become very daunting. So that's all I have to say on that.
Well, no, thank you so much, Robert, for sharing your experience and your observations there. I think you bring up such a fascinating point that it's not just about numbers and statistics. We're talking about people. We're talking about humans who all have needs and their own lived experiences and contributions to bring, and it's all interconnected, undoubtedly. Any other thoughts or observations about this module or things that you've been thinking about or experienced thus far? And I don't think we have anything new in the chat, right, Stephanie? Okay. So give me a second. I'm going to see if I can get the next one pulled up at the right spot. So bear with me for our last module to get. So I've got it ready to go. So the cat's already out of the bag. We all know what this topic is going to be about. This is going to be about the county's race and ethnicity dashboard. And the title of the module is called Using Data as a Foundation to Move Forward. And in this video, you will learn how to navigate Arlington County's race and ethnicity dashboard in the video. So with that, let me start sharing one last time. And I have it at the beginning this time. So here we go.
Designed to provide context to understand disparities and differences in people's lived experiences in Arlington. Be used as a baseline to measure racial equity, which is closing the gap so that race does not predict one's success in any areas of life, and be a tool to integrate when applying the equity lens to decisions around policies, procedures, and programs. To get to the dashboard, you go to the search engine and search for Arlington Equity. At the Realizing Arlington's Commitment to Equity page, you scroll down to the section titled Race Ethnicity Dashboard. The first page of the dashboard is a snapshot of the most recent year for each race and ethnicity individually. The other pages provide a deeper look at each variable and allow for comparison across all race and ethnic categories for a 10-year period. There's also a page that displays population shifts for areas within Arlington. Select each image on the right to learn about the specific pages on the dashboard. You must select all to continue. Page 1 provides high-level data that will be drilled down on the other pages. Page 2 shows the breakdown of the population in Arlington as it relates to demographics such as age, sex, and total population. Page 3 breaks down the population by census tract. Census tracts are unique geographic areas determined by the Census Bureau, which are used to track change over time. You might notice that the tracts are slightly different in 2010 and 2015 compared to 2020. This is because the tracts are updated every 10 years to reflect changes in population. Page 4 looks at socioeconomic variables such as poverty, income, English proficiency, education, and more. Page 5 examines variables related to households such as household income, type of home, occupancy, and more. Page 6 focuses on residential labor force such as mode of transportation to work, participation rate, and unemployment rate.
a dashboard is not meant to be a complete picture of racial inequities in Arlington, but it does present general information to spark conversations about inequity, inform public decision-making using a racial equity lens, and to serve as a starting point for a deeper analysis on a variety of topics. The briefing report can be used to better understand the dashboard and learn key takeaways from the data presented.
Because of Arlington's employment and wage disparity, people of color are at a disadvantage in managing the county's high cost of living, realizing long-term financial gains, and achieving economic security and purchasing power needed to manage a job loss, a disability, or an alternate housing to accommodate life changes. People of color still disproportionately earn less than $100,000 a year, a wage that cannot afford the median home in Arlington without substantial down payment assistance or public subsidy. Click each button to review related data. Household income among persons of color consistently lag behind white households. White households represent 3 out of 4 households in Arlington, but only represent approximately half of households who earn less than $50,000. Persons of color are 2 to almost 3 times as likely as white residents to live below the federal poverty level and have 1 to 3% higher unemployment rates. What percentage of the Hispanic and/or Latino population have a household income of under $50K in 2020?
So can everyone see? It's a little small in some spots, but this is a page from the dashboard. So take a look. So we're trying to find the percentage of the Hispanic and or Latino population with a household income of under $50,000 in the year 2020. So we're looking at this, I believe this households segment here in green. Does anyone want to wager a guess?
Sorry, it's a bit too small for
Is
me
it
to
too
see
small?
on my screen. Maybe other people have larger screens. I just can't see the numbers.
The bottom of your screen, you can try to make your screen a little bit bigger, but then it kind of it truncates, unfortunately, the side of the dashboard. So I'm not sure if
I'm a little worried to try to touch anything, and
Yeah.
I don't want to suddenly make it so I can't get it back to the full screen so we can finish watching the last couple slides together.
Can people see that household income graph within that larger household section? Yeah, right there.
Where is it identifying or separating it out by ethnicity? I don't see an ethnicity or race variable in here at all.
Yeah, I was having the exact same thought. So I am going to see. Go ahead.
Cynthia, if I can jump in.
Please.
Hi, everyone. I'm also with the Office of Race and Patricia Miguel. So under select race and ethnicity at the blue header, there's a little drop-down menu.
Correct.
That's where you can break it down by race and ethnicity.
I would have figured that out eventually, but thank you, Patricia. This is why you're here. All right, so we're still looking at the bar graph. And so
That's interesting because I think it changed whenever we selected the race ethnicity. I think it changed from percentages and now it has just a number of households. But maybe I saw it wrong on before we selected the race and ethnicity.
Yeah, because our only other choices are the county as a whole and then picking other ethnicities.
Yeah.
If I'm not mistaken, I think if you hover over the bar that you want, so over under 50K, is that a percentage? Or
No,
that's a number.
It's giving us numbers.
It's too much math involved.
I'll take a wild. I'll
Let's
take a
just
wild
guess
guess.
29 and be done
20.
with it.
That's
Let's
a good
guess.
guess.
All right. And this is obviously not all
I
of us
agree.
are completely well versed in this. Oh, look at that lucky guess. But the beauty of this is it does take some time. You need to be able to sit with it, study with it, click around on your own. It's a little harder to do in this group kind of exercise. Well, whoever suggested that, we got the right answer. So let's keep going. Learn about zoning and land use.
In Arlington, 79% of all land zoned for residential development allows only single-family detached housing. This type of zoning leaves out other housing options, which increases housing price and contributes to segregation by limiting the household options for households with lower income, which is overrepresented by people of color. Click each button to review related data. People of color are much more likely than white residents to rent as opposed to owning a home. Single-family detached housing is disproportionately occupied by white residents. What percentage of the Asian population lives in multifamily homes in 2020?
Okay, so we're going to start by clicking at the top, and we'll click Asian because that's the ethnicity that the question is asking. And we are trying to figure out how many lived in multifamily homes. So again, it looks like we're in this green household segment. And in this graph here, we have single family detached in blue, single family, I'm assuming attached in green, and then multifamily in purple. So if we hover over that, that's giving us a total number, but no percentage. So would anyone like to wager a guess?
73%.
Agree.
Correct.
And Cynthia, I think if you actually click on next to households, you see where it says click here for more. Does that open up households into a different view?
Let's see. It does. I think it's a little harder to read on the shared screen that we're in, but it's breaking things down into incomes, family, ethnicity,
And
household
percentages.
incomes, and percentages, yes.
Instead of absolute numbers. Yeah.
See, we're all learning how to better use this together. Okay,
This
let's
is more
keep.
of a math module than a
It is, and again,
demographics module.
It's more of an individual exercise too, I think. All right, so lastly, let's just look quickly at the educational attainment.
College graduation rates have increased across Arlington for all race and ethnic groups. While an improvement over the last decade, Black or African American, multiracial combined populations, and Latino or Hispanic residents are nearly half as likely to graduate with at least a bachelor's degree than white residents. Some potential factors include lower English proficiency and more than double the share of households without access to a home computer. Click each button to review related data. Limited English proficiency is still 4 to 5 times higher among Latino or Hispanic, Asian, and multiracial combined populations than among white and Black African American residents. Black or African American multiracial combined populations and Latino or Hispanic residents are almost 30 times more likely to not have access to a computer compared to white and Asian residents. What percentage of the Black or African American population had a bachelor's degree or higher in 2020?
Okay, so we'll toggle to Black or African American here. And we're trying to find education. So I believe we need to keep going until we can find education statistics. And we have here, and if everyone can kind of see, this is getting smaller. It feels like the later in the afternoon we get, but the up here in this upper quadrant, percent with bachelor's degree or higher. And so we're looking at the purple line for Black or African American.
Cynthia, do you want to move your cursor?
Yep.
To 2020. It was showing 2015 data. So that third dot on the little line chart.
So this one.
Yeah.
Thank you for pointing that out.
Yeah. So I think if you hold it there, it'll pop up, and yeah, now we can read it a little bit better.
Yes. So the answer is there for us. This was easier. Thank you, Madeline. So based on this, and now we're dealing with percentages, which is what we want, it should be this 51.2%.
Now that you've seen the impact of some of the data in Arlington County, let's see how a few of your colleagues have used the dashboard in their work.
I found it to be what I call a conversation starter. I found that I was asking myself a number of questions just looking at page one. And that was before I really started diving deeper into the tool itself. With the line of work that we do at Trades, I found the visual depiction to be rather interesting, and I think would be very valuable for our staff at Trades, making them aware of the tool. That's really where it starts. It'll start there, and that will create conversation. And the conversation then will create plans, actions, ideas, recommendations.
Vision Zero is seeking to eliminate traffic crash-related fatality and severe injuries. And we actually have an equity analysis as part of the Vision Zero action plan. And I'm thinking, wow, the dashboard, it doesn't need to be used alone. The dashboard can be used as a base map. And when you superimpose your actual field data, your area of expertise data with that dashboard data, it can reveal a lot of things that's related to, for example, are crash proportionally represented throughout the county? Are there any hotspots or areas that seems to suffer more from crash related consequences?
While the Race and Ethnicity Dashboard is meant to provide an overall look at Arlington's demographics, there is a supplemental tool available called the Census Tract Demographic Dashboard that provides demographic information at the sub-county level and allows you to drill down to specific locations. It can be used to report demographics for grants, determine communication needs for public engagement, or provide demographic information for reports and small area studies.
The Census Tract Demographic Dashboard can be accessed by typing in Census Tracts to the search box on the Arlington County webpage. This brings you to a landing page where the dashboard is hosted. Click on the image to open up the dashboard. I'm going to run through some few tips on how to use the dashboard, but you always have instructions here on this arrow to the left on how to use the dashboard. The dashboard functions by selecting a tract on this map. I'm going to scroll into the Ballston area. Then I'm going to use the selector tool here and select this tract 101409. As you can see, the dashboard has updated to reflect that selection. If you want to select other tracts as well and add that to the selection, hold down the Shift key and select as many tracts as you would like. As you can see, the dashboard continues to update with each selection. Now I'm going to clear that selection by clicking this X, and the dashboard returns back to the baseline. Because census tracts don't always align to civic associations, we've added a tool that you can zoom to the civic association area. Up here in the upper right, it says Zoom to Civic Association and none is currently selected. I'm going to click that box and then search for Radnor, Fort Myer Heights. That's zoomed right to the Civic Association. As you can see, the light blue area here is Radnor, Fort Myer Heights area. I'm going to change my selection tool and use the line. There, I'm going to select all of the census tracts that cross that Civic Association. And as you can see, the dashboard updated again to reflect that area. If you need this for a report, you can take a screenshot of the dashboard and make an image. If you need downloadable data, there's a reporting app right here above the map on this blue to print and report the map, and data tables use this reporting application. Click that link and that will take you to another similar application where you can select again the tracks that you need and export the data. Now it's your turn to play around with the census tract demographic dashboard. And don't forget to tell us how you're using it.
Today you learned about the county's race and ethnicity dashboard, what it is, how to use it, and why it should be used to support your racial equity work. You've also heard some examples of how it's being used in the workplace and got a quick overview of the census tract demographic dashboard.
So I think that brings us to the
Thank you for
end.
joining us as we continue our journey towards racial equity. We will see you again next time as we examine the relationship between equality, equity, and racial equity, and why racial equity is a priority.
All right, so that brings us to the end of the video portion of our session today. And as you can see, there's a lot of information here. The best advice I can give, having fumbled myself in front of all of you, is the more time you spend with it, the easier it becomes to digest and the easier it is to find the information that you're looking for. So hopefully this will come in handy to you. And I think there were a few of you who said that you hadn't played at all with the dashboard. Were there any that hadn't even heard of it before this session? Okay, so now everyone knows where to find it, and the census dashboard is another useful tool that, again, with a little bit of time and practice and patience, should be able to help you not only with your organizational work, but hopefully with grant applications and other reports and things that you need to compile. So lastly, we're just about at time.
Cynthia, before you jump in,
yes.
there's a question in the chat
thank you.
about where we can find the training videos. I know we're going to drop a link in the chat, and we'll also add it to the FAQs that'll be posted online.
I'm going to do that right now.
Thank you.
Bear with me.
It's also linked in the grant guidelines as well.
Okay, I'm going to put the main link in now, so then you will have access to all of them, not just the 3 that we watched together. And we'll make sure too that's in the FAQs. Any other general thoughts or questions before we wrap up for the day?
I'm good. Thanks for doing this, guys.
Yeah, you're welcome. Hope it's helpful.
Yeah, thank you very much.
The next one's on my calendar already, so I'll see you guys there.
See you next week. And so that's the perfect segue, just to remind those who haven't been tuning in. The next session is going to be next Tuesday on October 15th at 2 p.m. And in that session, some of our United Way partners are going to be talking about and explaining how to complete the logic model that is a requirement for the grant application, depending on your organization size and budget. So if you're interested in getting some great pointers on how to complete that, we would encourage you to join us again next week.
Good. Thank you very much.
Thanks very much, guys. Appreciate it.
Thanks everyone for your time. Hope you enjoy looking at all the modules on your own.
Thank you.
Thank you. Thank you.
Have a good
Bye now.
week.
You too. Take good care. Elizabeth, are you able to stop recording?